Hi everyone, my name is Taylor Snowden and my group and I are doing our presentation on gut health and colon-related conditions. Here's a background on the colon and gut health. The colon is the last part of the digestive tract. Its main jobs are absorbing water and electrolytes, forming stool, and housing a large portion of the gut microbiome. The colon affects gut health because it supports a balanced microbiome. This helps digestion and protects the body from harmful bacteria. When the colon's microbiome becomes unbalanced, inflammation and other digestive problems can occur. Imbalances in the gut can contribute to irritable bowel syndrome, inflammatory bowel disease, colitis, colon cancer, and other high-risk diseases. Constipation, bloating, and chronic inflammation are also other symptoms that can arise. We can improve gut health in various ways. Some ways are eating a high-fiber diet, drinking plenty of water, and limiting processed foods and excess sugar. Together, these habits help maintain a strong, diverse microbiome and a healthy colon. Next, I'm going to talk about a current research study that involves gut health and the colon. Feces were obtained from a healthy infant and from a 48-year-old with ulcerative colitis. The 3 bacterial strains in red font were abstracted from the feces and were proven to reduce colitis in mice. This shows how a healthy gut microbiome can prevent colon-related diseases. However, this study was controversial because it's a study on mice, but the bacterial strains were derived from humans. Doing these studies in humans is a significant challenge.
Hi, I'm Eileen, and I will be talking about current research and future implications. Currently, there's a lot of research on gut and colon health that focuses on how diet is reshaping the gut microbiome on a global scale. As lower to middle income countries shift more towards a westernized diet, which is composed of less fiber and more processed foods, which is also cheaper to produce, we're seeing big changes in the type of bacteria that are living in a human gut. Those microbiome shifts are strongly linked to increases in inflammatory bowel disease, IBD, and early onset colorectal cancer, CRC, both of which are linked to lower microbial diversity and more harmful bacteria, especially ones that create pro-inflammatory environments that not only cause the irritation associated with IBD, but also increases the risk of colorectal cancer. From the medical standpoint, there's also a lot happening in how we detect and treat colon-related conditions. Screening for early detection of colorectal cancer has become more accessible with simple, non-invasive tests like fecal immunochemical tests, FIT, stool tests, and colonoscopy accuracy has also been improving with the help of AI, and now doctors can catch polyps that they might have previously missed. On the treatment side, microbiome-based therapies like fecal microbiota transplantation, FMT, and newer standardized microbial products are now being used to treat recurrent Clostridium difficile infections, C. diff infections of the colon. We're also starting to see more personalized approaches to care that use a patient's microbiome profile to help guide treatment decisions. So overall, both research and clinical practices are increasingly centered around how the microbiome influences gut health. Looking ahead, one of the biggest global health shifts that we expect to see soon is called an epidemiological transition. As more countries develop, they move away from infectious diseases such as diarrheal infections caused by bacteria and viruses and towards more chronic conditions like IBD and colorectal cancer. This transition is driven by a combination of factors, including urbanization, aging population, antibiotics, but one of the biggest changes is dietary changes. The challenge that many health systems face now, especially in lower to middle income countries, are that they're not yet equipped with how to handle long-term chronic diseases. So this transition will bring about a significant new demand in healthcare systems worldwide. The future of gut health treatment is also likely to change as microbiome engineering and AI continues to advance. Scientists are working on engineered probiotics and bacteriophages that can precisely target harmful gut bacteria, which could create a new and less invasive treatment option especially for lower to middle income countries. At the same time, AI-based tools are becoming more powerful in detecting early signs of colon cancer, potentially leading to early diagnosis and better outcomes. If these technologies can become widely accessible, they can help reduce global disparities in gut health care. So the future really hinges on translating these innovations into solutions that work across different healthcare settings and not just ones in higher income countries.
Hi, I'm Abby, and I'll be discussing the importance of our topic, beginning with the different populations that it affects. Here we present the many different conditions that can arise from microbiome dysbiosis, and the references we listed present the possible correlations between gut microbiome imbalances and conditions such as IBS, Crohn's disease, ulcerative colitis, colorectal cancer, and type 2 diabetes. With this, though, it is important to note that these are mostly just correlations, and we do need more research in order to prove causation due to how diverse and complex the microbiome is. The many different conditions that we listed, from diabetes to cancer, shows how difficult it is to pinpoint the complex role of the microbiome in these diseases. Conducting more research may allow for better mechanisms in order to study these diseases and find preventative, curative, and palliative care options, leading us to our next point of why it is important, the future. Sources have shown that colon cancer rates are already on the rise and are expected to increase significantly if no changes are made. In the future, with more research, we may be able to prevent and treat these conditions through the use of pre- and probiotics. We may also be able to utilize nutrition intervention, especially increasing dietary fiber, as a way to prevent a number of these conditions.
Ella, and I'm going to talk about gut health correspondence to medical innovations. So we have seen a correlation between individuals who experience gut health issues and not having a colonoscopy, because there is a balance between gut health and colons, because the colon can affect the balance of the gut health, and the gut health can also affect the microbiota of the colon. So individuals who do not get a colonoscopy might not know about their gut health issues, or if they have gut health issues, they might not know it's affecting their colon without getting a colonoscopy. And then furthermore, new diagnostic innovations can show the relationship between colon microbiota and gut health, because the microbiota of the colon can be affected by poor or good gut health. And then more so on that, a balanced diet such as like leafy greens and fiber can protect the mucosal membrane of the gut health, or of the gut, and this can also prevent colon cancer. And then some key takeaways is that the bacteria in the gut can break down food that the body cannot and keep the body healthy. And the state of the gut can impact other functions of the body and can cause or prevent disease in other organs. And now I'm going to play a quick video just to show a little bit more into what we've been talking about and how our gut can be affected.
Dietary fiber from foods like fruits, vegetables, nuts, legumes, and whole grains is the best fuel for gut bacteria. When bacteria digest fiber, they produce short-chain fatty acids that nourish the gut barrier, improve immune function, and can help prevent inflammation, which reduces the risk of cancer. And the more fiber you ingest, the more fiber-digesting bacteria colonize your gut. In a recent study, scientists exchanged the regular high-fiber diets of a group of rural South Africans with the high-fat, meat-heavy diets of a group of African Americans. After just 2 weeks on the high-fat, low-fiber, Western-style diet, the rural African group showed increased inflammation of the colon as well as a decrease of butyrate. That's a short-chain fatty acid thought to lower risk of colon cancer. Meanwhile, the group that switched to a high-fiber, low-fat diet had the opposite result.
These are just some of the sources that we used. Thank you for watching.